So rather than talk further about market access, although there are some inferences that can be made here, I want to talk a bit more about long-term care, which is really a niche market in and of itself, and some of the things that we've learned with a variety of our programs over the last, I don't know, really 6 or 7 years that we've been deeply into it, and especially a recent program that we've done that's risen to some prominence in the area. Key things: understand the influence map, mirror what's happening in the system, taking the time to plan, and building relationships. And these are important things when you're actually rolling into a niche market. Quick demographics, only talking about long-term care today. There's a whole bunch of other areas in seniors housing, also important niche markets. But if we got into those, then I'd have to bring 100 slides. About 200,000 nursing home residents. Interestingly, the key thing about them these days seems to be the rising levels of acuity that we see. I was at an OLTCA event last night, and we actually saw acuity levels used to be 18 months. We had a home talk to us about 4 months before patients passed on, so extremely sick people. They consume about 12 RXs per day, so not small. Compare it to, say, the average purchasing in Newfoundland or PEI, quite a bit more pharmaceutical use in nursing homes in Canada. Really big regional differences. A lot of different reimbursement models, a lot of different distribution models, and a lot of different regulatory models that guide how people actually provide care. Just in terms of the reimbursement models, we have a protocol that's being used right now. And we got a call from a region. Well, we can't use the drugs in your protocol because they're not on our formulary. Go figure. Interestingly, the sickest people in that particular province didn't have access, sickest seniors in that province didn't have access to a drug that was universally available to every other senior in the province through the regular public drug plan. So there's an opportunity to drive actual access by looking at this particular niche market. Getting into the influence map, first question, how big is that map? There's layers of influencers, and each one has their own set of needs and wants. There are stereotypical roles out there, and do those stereotypes apply? And this will change from niche market to niche market. Certainly, and I said I wouldn't talk about retirement, but a nurse in a retirement setting is going to behave very differently from a nurse in a long-term care or nursing home setting. Are there any unique influencers, people that can carry particular weight? Obviously, these are people you'd like to build relationships with at some point. So in the long-term care market, what we see is multiple tiers sort of floating around how the residents behaves. We have corporate management who run the outlets that actually provide care. We have just a massive amount of government regulation. If you looked at a stack of nursing home regulations, it would be about that tall in terms of what they have to do every day and what they have to be familiar with. One of the trends that creates is that the individual home providers are being slowly phased out or moving to a managed setting, and the large providers are more or less taking over. A lot of third-party people involved, but not directly involved to the resident. Doctors, pharmacies, all sort of rotating around the residents, and finally associations. Medical directors associations, nursing associations, pharmacist associations, corporate associations, and even government associations that guide how long-term care is delivered. Within the residence itself, the people who at times feel very much at the mercy of everything around them, residence management, clinical licensed staff, care staff, operational staff, residents and their families who are very underestimated in their ability to influence the market. Without understanding the roles in each of these map positions, and some of the things that I didn't put on there because there are other factors that drive the map, you could be driving a concept that's unpopular without even knowing it, and maybe get stopped in your tracks before anything comes of it. So important to think about when you get into niche marketing is getting those opinions across the influence map. You want to mirror what's happening in the system. We've heard about things being outcomes-based in nursing homes in Ontario and many other provinces. There is a huge database of healthcare status. In many cases, it doesn't even take particular pharmaceutical use into consideration, but it does look at resident health status. for example. And there's some big data that I really wish I could get my hands on more often, because it's actually pretty interesting. Understand how, why, and where measurements are being made. In Ontario, it's about key performance indicators and what the residences are doing about the health of their residents. And collaborate. Don't force issues. You've got to look in terms of partnerships. And without them, you're going to find gaps that are well beyond your ability to collect data. With them, you'll actually be able to identify those and address them, and hopefully collect new data that helps to drive your message. You want to align to the system. So with Diabetes Connect, which is the big program I was talking about with you earlier, you want to be able to identify the key measurable items to confirm impact. We looked at hypoglycemia transfers to acute care, hypoglycemia response within the home, both of them big issues for nursing staff. We looked at select medication use. One of the things most of the clinicians didn't want to see anymore, for example, sliding scale insulin use. You want to leverage the existing measurement system. RI-MDS will come up, pharmacy systems will come up to actually understand what's going on. And again, what it did was allow us to forge partnerships across the map, because we could actually start telling them what was going on with their residents and tell them how to improve things. Take the time to build a good plan. Good plans don't start with doing. Many times we're approached and, oh, well, you know, we don't need to plan. Let's just go in there and get them using our product. Well, two important factors there. It's not about your product in the home. It's about the resident. If your message isn't right, they're not going to listen, and you've just wasted your time. Or you've shut the door for yourself for a long time going forward. So you've got to take all those steps up front before you can really address a niche market, I guess, is what we've learned there. Confirm and dispel traditional myths. This goes back to stereotyping and how different residents of the influence map will behave. You want to understand if it's true or not, and understand where you fit. With pharmaceuticals, increasingly, and I think this actually came through pretty clearly in some of the presentations we heard earlier, it's more about being of the system as opposed to being in the system. So with our program, all the key players were at the table. We had a multidisciplinary team. We had a major outlet sponsor us. We had a drug manufacturer involved, but actually at arm's length. We had a specialist who was involved in guideline writing. We had the LIN involved, and we had all the different members of the staff, and the pharmacy actually too. Some of the myths we dispelled. Actually, the dispel here is that government provider, pharmacy, and pharma don't work well together. They actually worked really well together. Once they started identifying what their common goals were, things moved quite smoothly. Multidisciplinary teams actually accomplish something. Often the myth is that groups of diverse people can't do anything together. And really importantly, quality of care in a nursing home can be improved. So there's a lot of perception, because they are so overloaded, because the acuity levels are so high, that they can't get anything done. Finally, relationships are key. When you're approaching any new niche market, it's critical to make a good first impression. If they don't like the looks of you, you won't be back. Make a better second impression. If you haven't figured out what it is they need, what it is they want in your first meeting, you probably don't want to have a second meeting, because they're overloaded with people who are dying on them every day. And if you're not bringing something back that's going to help them, or at least talking about how to approach helping them, they probably don't have time for you, because someone else will be, at least in the nursing home setting. And finally, a good guide can make all the difference. If you're set up properly to have these initial meetings and the downstream meetings that may result, everything turns out well. On that note, when things are done well, prestige and rewards can be found. Our Diabetes Connect program from an initiative, and Omnicare, and the East Lynn, and medical pharmacies actually was involved as well. Won the OLTCA Quality Improvement of the Year, and it's now actually rolling out across Ontario, thanks to the OLTCA, that's their CEO, Candace Chartier there, and also nationally and into retirement, which was really interesting. So another sector that's actually asked us to come and help them with diabetes as well. So that's what I have. Do I have time for questions, Mitch? He says no. Good. Thank you.